100 billion neurons, X number of neurons start dying. If the oxygen doesn't go to the brain cells gets damaged. When a baby is getting delivered, the baby doesn't cry.
Most of the people knows lakku aitu, kaying aitu. So when we say rehabilitation, in Kannada it is called punarjanma. That is another life.
A little bit of weakness will become complete weakness, called hemiplegia. A lot of neurons, which is supposed to do a lot of activity, is dying.
Asymmetrical face, like one side of lip movement will not be there, one side of tongue movement will not be there. Interventions that are done during the golden period.
Every second matters according to me. Forget every minute. Because every second the brain does not get oxygen, one of its most important nutrients, the brain cells die. Now, how many brain cells die will depend on how sensitive they are to this oxygen need and how quickly they can adapt or how long they've been without the oxygen, which is the blood supply to the brain. If that happens, out of 100 billion neurons, 100 billion neurons, X number of neurons start dying. The classical way for you to remember this is when a baby is getting delivered and the baby doesn't cry. The first business you go into any labor room is the moment the baby comes out and the umbilical cord is clamped, the baby has to cry to take the breath. The moment the umbilical cord is clamped, the oxygen to the baby from the mother is cut. Now the baby has to get its own oxygen, which is by breathing. Till then the lungs are not working in the baby. Okay, the moment the baby has to breathe, the baby has to cry. Because when you cry, you take a deep breath and the entire lung expands. That's why you will see the doctor turning the baby upside down and potter, giving the baby nicely on the bum. So the baby cries. The louder the baby cries, the better it is for us in the labor room. Not otherwise. That's what you have to understand. The pinker the baby looks, the more oxygen is gone into the baby's blood. So what happens if the baby doesn't cry immediately? Nobody knows that 1 minute or 2 minutes, 3 minutes, the baby didn't cry, everybody is cramping, then something happens, ventilator, this, that. They don't even know until 6, 9 months, 1 year, 2 years, 3 years later, when the baby has learning difficulties, failing in the school, lagging behind the milestones from other children. That's when you know that 2-minute delay in crying has caused this effect. And in the worst case scenario, the baby is mentally challenged and sometimes even bedbound. The same thing you translate to an adult person like you and me. If the oxygen doesn't go to the brain cells gets damaged. What we know we forget, and the brain cells die. And depending on which area of the brain gets affected more than others, depending on where the blood supply is not going, that function is gone. Whether it's to do with walking, talking, eating, memory, speaking, vision, all of those get affected. That's why we say time is brain. Every minute counts, and I'm telling you, every second counts.
In stroke, what happens is because of lack of oxygen to the brain, the brain cells die. So the time is brain is because earlier you reach to the hospital so that they will do the basic investigation. If it is a block, they will give you a thrombolysis, or if it is not successful, they do something called thrombectomy. These are the medical procedures which has to be done within the window period. Now it is 6 hours. So how this is helping us is, if you have a block, for example, you take a tree has a branch. So you have a bigger branch and you have a smaller branch and smaller branch, like that you have further. So it depends on the size of the thrombus. The block will be more proximal, that is more closer to the central portion. So that this will affect the major areas. More area will be affected. More areas will not get blood supply. But if you thrombolyze, what happens? It will become smaller fragments, or it will dissolve and go away. It is better to be a dissolved or a smaller thrombus than a bigger thrombus. Bigger thrombus, bigger area. Bigger area, more problems. That's it. So when we rehabilitate, we want more, live cells. If the brain cells are dead, even though we talk about neuroplasticity, the adjacent area will take up the function, those things are not going to happen that easily. Unless you have viable cells, cells which are function. That is very, very important. The second thing what they are doing is you have a stroke here and you have the area which you got a thrombus which is called umbra, and you have a periphery collateral circulation which is called penumbra. So the idea of this thrombolysis is to prevent this penumbra area, to reduce this penumbra towards the umbra, so that we can preserve more area, viable cells, which will regain its functionality. That means already stored information can be stored. Now in our rehabilitation, so when we say rehabilitation, it is called punarjanma. In Kannada, it is called punarjanma. That is another life. That means you got a disability and you get another life. But what happens is, if you get a stroke, half of this body become paralyzed, most commonly. Okay, it can be half of your lower body also can get paralyzed in stroke, or upper extremity. Anything can happen. Vision half can go, right? Swallowing can get affected. So many disabilities can happen. Most of the people knows lakku aitu, kaying aitu, but visual problems can happen. So many other problems also can. Perceptual problem, artha sensation they will not understand half of the body. So like that, so many problems can happen. These are all happening because language problem can happen, understanding will be, speech can be a problem. Now, as an occupational therapist, I need all these things to perform his ADL, activities of daily living. What are they? Their self-care. They have to take care of themselves without giving burden to the family. Second thing, they have to work to earn. Third thing, they have to make sure they spend their leisure time properly. If these three things has to happen, they have to have all the component skills. Body has to be stronger, hand has to be good, walking balance should be good, vision has to be good. So when you are thrombolizing the patient, you give more possibility of the patient get back to the same functionality with the same movements, same function. No, their visual field will not be so much affected. So the possibility of getting back to maximum functionality as before. So now when we are rehabilitating, we have something called rehabilitation path. So you can take a restorative path or a compensatory path. That means if I have right side hemiplegia, and now I cannot eat with my hand, then I have to compensate with my left hand, or I have to use some adaptive tools to use this hand too. So this is not the functionality which I want. I want my hand like before. Everybody wants that. I want to go back to my original past, because I am not able to accept the disability. So for that, everybody has to be trained. If you want to have an original past, you have to reach to the hospital in the right time. You have to get as many as functional neurons in your brain for us to retrain them. We have to retrain them. Otherwise, we have to start the retraining from the scratch. It may not be possible. Then we have to go for more compensatory strategies. So if you want a more restorative strategies, get back to the function like before, this is very, very important. That is why time is brain. It is not just to save the life, it is to save the functionality also.
Every minute definitely matter in stroke. One, if we pick up the stroke symptoms early and we do the early treatment like thrombolysis or any other treatments, the amount of brain damage reduces. For me as a physiotherapist, the amount of time that I need to spend on treating will become much more, much smaller. Some people, if they don't pick up early, a little bit of weakness will become complete weakness called hemiplegia. Not even picked up, sometimes they lose consciousness, they go to coma. So I need to start from activating the brain, like coma stimulation, all of those things. I'll have to work on how to gain the neck control like a baby, how to make them to sit, how to teach them to come up to sit, so on and so forth. Some people if we pick up early and you do the right treatment, they walk out from the hospital at the time of discharge in a week or two. But if it is not picked up early, then what happens? The brain damage becomes so much. They may take 1 month or 3 months, 1 year, or some people never will be able to walk again after a stroke. So, for me as a physiotherapist, every minute matters, every second matters, because every second a lot of neurons, which is supposed to do a lot of activity, is dying. The effort, energy, time that I need to spend with that patient who has not come on time is way too much. You don't want to be bedbound ever. The moment you see symptoms, the moment you see someone else stroke symptoms, rush to the hospital, get the treatment early enough.
Sort of say this in three things. One is the speech. So speech is basically what? The clarity. So a person who would have maybe had a very slight, what we call as dysarthria, which is not intelligibility of speech, from somebody who would have very mild dysarthria to severe dysarthria. Along with these things, you would see is the asymmetrical face, like one side of lip movement will not be there, one side of tongue movement will not be there, and this increases in severity as the minute goes. Second is language. From something as small as not able to, it's a very important thing, but still not getting few words. From there to not being able to speak at all, to not being able to understand at all, to being in a coma. So that severe it can get based on how much time you waste not taking the patient to a hospital. The third thing is swallow. Swallow again, from not having any aspiration at all or not having any problem with swallowing to severe swallowing disorders as severe as not able to swallow their own saliva, where every swallowing of saliva they have a cough, it goes into their lungs instead of going to the stomach. That is how severe it can get. And many times we have seen patients who come quickly to the hospital. They come with dysarthria, they come with some amount of aphasia, and if they come in time and they undergo the interventions like clot busting injection of tenecteplase or any kind of thrombectomy, any of the interventions that are done during the golden period, we've seen many a times they recover completely as soon as the procedure is done or within few hours after the procedure is done. So even if you see from a hospital stay perspective, from somebody who could get discharged within 2 days of getting admitted after a stroke to people being there for months or years after a stroke.
In stroke, every minute matters.
As a physiotherapist, every minute matters.
Every minute matters.
Every second matters, according to me. Forget every minute.